If you were going in for a scheduled C-section and the staff there tried to place your Foley catheter before you've had your spinal, just know you don't have to do that. Foley catheter is a little tube that goes in through your pee hole into your bladder to drain the urine in your bladder to prevent bladder injury. And there is no reason for it to go in before you're numb. Zero. When I talked about this yesterday, Bundle Birth did a poll about when people place Foley catheters, and the vast majority do it after you're numb with the spinal, which means that for these people, ain't no reason, because we can place it when you're numb. Some reasons that I'm hearing that this is happening is because the spinal will wear off. Yes, in 2 hours, and placing a Foley catheter takes about 30 seconds. In fact, the next time I work, I will time myself to see how long it takes to place a Foley catheter. And for those of you who do it before the spinal for this reason, because it might take too long, at my work, we set up our sterile field with the Foley on a table before the patient ever even comes in the room. So the tray is open. You got your gloves already out. You have squirted the lube into the little tray. You put the catheter in the lube so that it goes swipe, swipe, swipe. That's the cleaning stuff. And then put it in and inflate the balloon. And then we're done. Also, there's time between the spinal and when we're ready to cut. Like, you gotta wait for people to get numb. So there's time to do that. The other reason that I'm hearing is because if we do it before, there's more privacy. How many people you got in the OR? And if a patient truly doesn't want there to be more than one person around, sure, you have the opportunity that they can ask for one before. I don't know that I've encountered too many people who would want something to be painful for the sake of privacy, but they have that absolute right to say so. I just want you to be informed that you have the right to ask for this to happen after your spinal. In fact, I would straight up, if it was me, I would straight up refuse a catheter until after I was numb. Absolutely not. And if you work at a hospital where this is commonplace, challenge it. Why are we doing stuff that don't make no sense? There is zero evidence, none at all, that says that placing a Foley catheter after a patient is numb increases the risk of anything other than comfort for the patient. Also, I guarantee you, if boys had babies, they'd put them under general anesthesia for a freaking Foley catheter, okay? They'd say, F them babies. Give me the general anesthesia. We've come so far in women's health, but we need to always be looking out for the things that are done for convenience of a healthcare provider rather than for the benefit of the patient. What are some things that you've seen be like standard that you think are probably more for provider convenience rather than the benefit of the patient?